Hi everyone, welcome back to my YouTube channel. So in today's video, we shall be discussing how to write an admission note. So in today's video, we shall be discussing how to write an admission note. So the first thing we need to consider is by having the patient's biodata. So the first thing is patient's biodata, patient's biodata, patient's biodata. So the first thing we need to have is patient's biodata, which is name of the patient, name of the patient, name of the patient. So the first thing we need to have is name of the patient, then age of the patient. Age of the patient is very important. Then we need to have sex of the patient or gender. So we need to have the gender of the patient, that is male or female. Then we need to have contact of the patient. We need to have contact of the patient or the address of the patient. So the first thing we need to have is biodata of the patient. So that is the name of the patient, age, sex, and contact. Then the second step we need to have is by having physical measurement. For example, the second one is having physical measurement, physical measurements, physical measurement, physical measurement. So the second thing we need to have is physical measurements. That is the weight of the patient, weight of the patient. Whenever you are writing admission note, it's important to have all this information. So weight of the patient, then height of the patient, height of the patient, which is expressed in terms of centimeter, and weight is expressed in terms of kg. We also need to have head circumference, head circumference, head circumference, head circumference. So we need to have head circumference of the patient. Then the third thing we need to have is the vitalis, is the vital signs, vital signs, vital signs. So we need to have the third thing we need to have is the vital signs. This includes the SbO2. This includes SbO2. We also have the BB, which is the blood pressure. We also need to have pulse rate, pulse rate. We also need to have respiratory rate, respiratory rate. Then last we need to have temperature of the patient, temperature of the patient. Okay, after recording the vital signs, then for example you start by doing the history checking. That is, you need to ask the complaint of the patient. Then we can say, for example, B is troxy. So now this is presenting complaint. For example, your patient is presenting persistent cough, persistent cough, persistent cough, shortness of breath, shortness of breath, shortness of breath. Also tachycardia, tachycardia, that is greater than 100 per minute, 100 per minute. Also tachypnea, tachypnea, which is also greater than 18 breath, 18 breath per minute. You also have difficult breathing, difficult breathing. So your patient presents the following complaint: persistent cough, shortness of breath, tachycardia, that is greater than 100 beats per minute, tachypnea, that is greater than 18 breaths per minute, difficult breathing. Then we go for the That is on examination, that's a physical examination, which is expressed at O stroke E means on examination. On examination, then what do you do? Sick looking. What you write is sick looking. BOCO GO O stroke L, clinically febrile. Clinically febrile. For example, in your physical examination, you have done sick looking. PO, that is pallor. CO, which is cyanosis. GO means jaundice. O means edema. L means lymphadenopathy. Clinically febrile, whereby the patient is in a febrile condition, that is fever. Then what we go for review of systems, that is systemic examination. Systemic examination. So you go for the systemic examination. The first one we have is respiratory system. Respiratory system, for example, adventitious breath sound heart. Adventitious breath sound heart. Or chest in drawing. Chest. So whenever you are doing respiratory system examination, you have found that an adventitious breath sound heart, chest in drawing. Then secondly, you go for the cardiovascular system, which is CVS, cardiovascular system. So in the cardiovascular, you observe S1, S2 heart, no murmur, no murmuring, no murmuring. Then you go, that's the CNS, that is central nervous system. Then you can either use two options. For young people, for children, you can use the AVBU. For adults, you can use the Glasgow Coma scale. So assume this is a young patient. Then let us use for the AVBU. So in our AVBU score, we have A, which means alert. That is. Then we go for the GI. GI means in the gastrointestinal, that is the abdomen. Then it is soft, non-tender, no palpable mass. No palpable mass. So whenever you're doing general examination in the abdomen, you have to observe if there is a softness, tenderness, or if there is maybe palpable mass. So this is how we are going to do. Then you go for impression. Then we have two steps remain. So for example, we go for the assessment. So in the assessment, so for example, you may have impression. So you must provide a possible diagnosis. For example, when you look at the patient's complaint, persistent cough, shortness of breath, tachycardia, tachypnea, difficulty breathing. So when you look at this, these are the symptoms of bacterial pneumonia. So what will be your possible diagnosis? So in the impression, you can write severe pneumonia. Severe pneumonia. So our impression or our possible diagnosis is severe pneumonia. Then we go for the plan. So in the plan, this is the last step whereby you are going to treat the patient. Then what you do, for example, admit. So if it is a young people, you admit in the pediatric ward. If it is another adult person, so you can admit him in the adult ward. So assume this is a young child, so we can admit to pediatric ward. So admit to pediatric ward. Then IV antibiotics. IV antibiotics at as per treatment sheet. As per treatment sheet. So IV antibiotics as per treatment sheet. Then monitor vitalis. Monitor vitalis. Then this is the last step whereby you have admitted the patient for treatment. So these are the best way for you to admit a patient. First, you need to have the biodata of the patient, name of the patient, age, sex, and contact. Then you need to have the physical measurements, that is the weight of the child, height, or head circumference. Then you must have the vital signs, that is SpO2, oxygen saturation, blood pressure, pulse rate, respiratory rate, temperature. Then you must make a history taking. For example, clinical history taking, that is you must write down all what your patient reports. For example, presenting complaint, persistent cough, shortness of breath, tachycardia, tachypnea, difficulty breathing. Then you go in the on examination, that is physical examination, sick looking, PO, CO, GO, OL. So PO means pallor, you have to examine if there is pallor. CO, which means cyanosis, bluish skin color due to decreased hemoglobin level, jaundice, edema, or lymphadenopathy, presence of infection, syphilis, and tuberculosis. Clinically febrile, that is the patient is in fever. Then you go for review of systemics, that is systemic examination. We have started in the respiratory system, adventitious breath found heart, just in drawing. Then for the cardiovascular, S1, S2 heart, no murmur. Then in the central nervous system, we have applied the AVBU. So our score is alert, which means the patient is alert. Then in the abdominal, that is the GI, gastrointestinal, soft, it is softy, non-tender, no palpable mass. Then our assessment is we must find a possible diagnosis for the patient's complaint. That is, our impression will be severe pneumonia. Then we must take another step for treating the patient, that is the plan. Then admit to pediatric ward, IV antibiotics as per treatment sheet, then monitor vitalis. Then you put your signature last. So this is how you are going to admit a patient. Thanks for your watching. Have a nice day.